All right, today we are going to do a deep dive into something called the Healnile Hospital Information Management System. This is a platform that's really designed to be the central nervous system for any modern hospital or healthcare facility. So let's jump right in. So let's start with a big question. What if your entire hospital, and I mean everything, ran as one single intelligent connected system? Imagine a place where every department, every single doctor, and every bit of patient data is just seamlessly linked, where information just flows, from the front desk to the lab to the operating room, and then back to billing, all without a single piece of paper changing hands. That's the big idea that Healnile is trying to solve. But let's be honest, for a lot of hospitals, that's not the reality. The reality is, well, it's messy. You've got these fragmented operations that cause huge delays. You have those long, frustrating lines of patients waiting. And you have data that's just locked away in different systems that don't talk to each other. Now, this isn't just about being inefficient. It can genuinely impact patient care and, of course, the hospital's bottom line. And this is exactly where Healnile comes into the picture. It's built to be a next-generation system, one that's designed from the ground up to connect all those broken pieces. The whole point is to create a single digital ecosystem that manages the entire patient journey from start to finish, and to do it intelligently. So to really get a handle on how this actually works in practice, we're going to follow a patient. We'll trace their digital journey through a hospital that's running on Healnile. This way, we can see exactly how each part of the system connects and, adds real value at every single step. So our journey starts where it does for most people, the outpatient department, or the OPD. This is the main front door for the hospital. And the flow here is designed to be totally seamless. It starts with registration, then moves to a smart queue system, right into the doctor's office, and ends with digital prescriptions and orders. Okay, step 1, registration. The goal here is simple but absolutely crucial. Create one single accurate patient record that lasts a lifetime. The system grabs everything, demographics, biometrics, next of kin, and gives the patient a unique health ID. But here's the really smart part. It has automated duplicate detection. You know how you sometimes end up with 3 different files at the same hospital? This system is designed to kill that problem for good. It also immediately figures out if this is a new visit, a follow-up, or even a teleconsultation, and it captures who's paying, cash, insurance, whatever. This sets the stage for perfect billing right from the get-go. After a smart queue system gets the patient to the right place without a long wait, we get to the absolute heart of the visit, the doctor's consultation. And the doctor isn't flipping through a stack of papers. Nope, they have a complete electronic medical record, or EMR, right there on the screen. And this is where you really see the power of having everything connected. The doctor can instantly see the patient's entire medical history. We're talking past diagnoses, medications, allergies, the whole shebang. They see the insurance status. They use standardized codes for diagnoses, and they can even pull up special templates for, say, dental or eye exams. And here's the game changer. They can order labs and x-rays digitally. This is called CPOE, and it means no more trying to read messy handwriting. It completely eliminates errors and makes the whole diagnostic process way faster. So when the doctor clicks order, those digital requests don't just vanish into thin air. They immediately kick off workflows in the hospital's diagnostic departments. Let's pull back the curtain and see how this next layer of the patient's journey gets built. First stop is the Laboratory Information System, or LIS. Now, this isn't just some glorified spreadsheet for typing in results. Think of it more like mission control for the lab. It's a complete end-to-end system that tracks a blood sample from the exact moment it's collected to the very second the final report is signed off on. And it has some amazing features to guarantee accuracy. Every sample gets a barcode, so mix-ups are practically impossible. It has bidirectional integration, which is a fancy way of saying the lab machines talk directly to the system. No human has to copy-paste the results, which is a huge source of error. It also has really robust quality control built right in, using statistical rules to flag anything that looks fishy. And nothing goes out until it passes a multi-tier validation, meaning a pathologist has to give the final okay. It's a very similar story over in radiology. The Radiology Information System, or RIS, does the same thing for imaging. It manages the entire workflow for X-rays, CT scans, and MRIs, connecting directly to all the high-tech machines. Yeah, this quote from the source material really hits the nail on the head. It streamlines the whole process. By linking the doctor's order directly to the scanner, and then pushing the final report and the images right back into the patient's electronic record, the system just cuts out all the delays. It makes sure the doctor has a complete picture, literally, of what's going on. And, of course, the loop isn't complete without the pharmacy. Here, everything is about patient safety. Dispensing is tied directly to the doctor's e-prescription, so the pharmacist can't accidentally give out the wrong drug or the wrong dose. The system is also constantly running checks in the background, flagging any potential drug interactions or patient allergies. It's an incredibly important safety. Okay, so what happens if our patient's condition is more serious and they need to be admitted to the hospital? Well, the journey just keeps going, and Healnile is designed to make that transition from outpatient to inpatient care completely seamless.
Right, so once a patient is admitted, the level of complexity just skyrockets. Suddenly we're dealing with beds, nursing shifts, complicated medication schedules, special diets, you name it. The system's inpatient department module, or IPD module, is built to orchestrate this entire complicated dance.
The most important thing here is real-time visibility and control. The main nursing station has a live dashboard showing the status of every single bed. Is it occupied, vacant, being cleaned, or under maintenance? The medication administration record, the MAR, is fully digital, which means nurses get alerts so meds are given on time, every time, and it's all logged perfectly. This gets paired with graphical charts for vitals and even digital shift reports so the next nurse knows exactly what's going on. This slide just lays it out so clearly. It's a stark contrast. On the left, you've got the old way. Messy paper charts, doctors shouting orders, manual requests to the pharmacy. It's a system just begging for errors. But on the right, you have the Healnile way. A digital MAR with built-in safety alerts, electronic requests that are tracked in real time, and full traceability for every single action. The gains in efficiency and, more importantly, in safety are just massive. And for patients who need surgery, the Operation Theater module brings a whole new level of control to a high-stakes environment. It's not just about scheduling a room. It actually enforces critical safety protocols, like the World Health Organization's surgical safety checklist. And it meticulously tracks every single item used during the procedure, every sponge, every implant. This is not only vital for patient safety, but it also guarantees that the final bill is 100% accurate. Okay, so we've been deep in the weeds, right? We followed our patient all the way through their journey. Now let's zoom out and take a look at the big picture, the total impact of creating this unified health ecosystem. This image really captures the whole philosophy of the platform. It's designed to be the engine that powers the entire hospital lifecycle. It connects all the different gears of the hospital, the clinical side, the administrative side, and the financial side, and makes them all work together like one smoothly operating machine. And this quote just perfectly sums up the core value here. The ultimate goal is really twofold. First, and most importantly, improve patient outcomes by providing better, safer, more connected care. And second, cut down on the crazy administrative burden for doctors and staff so they can focus on the patient, not the paperwork. So when you put this all together, what do you actually get? Well, the benefits really boil down to three key areas. First, patient safety goes way up because you're dramatically reducing medication and diagnostic errors. Second, the whole place becomes more efficient, which means shorter wait times for patients and better use of hospital resources. And finally, you achieve financial integrity. Because every single service and item is captured and billed correctly, you eliminate that revenue leakage that can cripple a hospital's finances. And that really brings us to our final thought. As technology continues to just completely reshape healthcare, this shift from fragmented, messy systems to a fully connected model of care, it feels pretty much inevitable. So the real question isn't if this change is coming, but who's going to be ready for it when it does.